Welcome to Hands on Health, the podcast all about living your healthiest life on the coast. I'm your host, Felicia Struve. I caught up with Dr. Regina Mysliwiec before she started a shift in the emergency department at Columbia Memorial Hospital. Dr. Mysliwiec is a key member of the hospital's COVID-19 response team. If you have questions or concerns about the COVID-19 vaccine, please tune into this episode. It's important for your health and the health of our community. Well, today I am joined by Dr. Regina Mysliwiec, and she is the Director of Emergency Medicine at Columbia Memorial Hospital, as well as many other things. Can you tell us a bit about yourself?
Oh, sure. In addition to being the medical director at Columbia Memorial Hospital Emergency Department, I'm also the physician supervisor for the EMS course at Clatsop Community College and for several local fire departments, including Astoria, Seaside, Cannon Beach, Lewis and Clark, and Olney-Woluski.
Wonderful. Well, we are chatting today about the COVID-19 vaccine because it is just days away from being here in Clatsop County for some of our first responders and our frontline caregivers. Here in Clatsop County, we've had 2 deaths, sadly, so far from COVID-19. But that doesn't seem like a big deal to a lot of people. Why is the pandemic and getting the vaccine for COVID-19 such a big deal?
This is such a great question. Out here on the coast, we have been so protected. We read the news and we see on TV what's happening in other places, and it's terrifying. But we have not been suffering in necessarily the same way or with the same severity. Across the country, at least 2,000 healthcare workers in the U.S. have died from COVID. Hundreds of bus drivers and train conductors. People who are pregnant are at increased risk of death when they have COVID by 70% when compared to people who aren't pregnant. More than 130 U.S. children have died from COVID. So why is it such a big deal? The world has been fighting viruses, including viruses like this coronavirus, for instance, influenza, for hundreds of years, millions dead over time. I don't think that's what we want COVID-19 to become, even if it doesn't seem that bad to us now. Influenza killed almost 200 children during the 2019 to 2020 flu season. And I wonder, is that the best we're hoping we can do with COVID? Or maybe we can do better? Can we each, as citizens, do more to protect children, to protect the elderly, to protect caregivers who take care of our grandparents in nursing homes, and frontline caregivers who need to stay healthy and present to care for people having strokes and heart attacks, people having babies, people suffering from traumatic injury, for the bus drivers who get people to work when they can't work at home. In 2020, by the time we reached October, 1,500 nurses had died from COVID all over the world. Men and women whose job it is to care for and to tend to the sick and injured are dying from a disease that we can't cure. We can only wash our hands, we can cover our coughs, we can keep our distance from people, avoid crowds, clean our homes and workplaces more frequently. But now we can get vaccinated. We can't cure COVID, but we can do these other things. We can and we should.
You make a very compelling case for getting vaccinated. How does the vaccine protect me and protect other people?
Great question. So the vaccine is a little different from other vaccines that we've had, from the flu vaccine, from vaccines like meningitis and hepatitis. So the way the vaccine protects us is that it contains a small amount of genetic material. It's called mRNA or messenger RNA. This genetic material encodes a special protein that's on the virus that causes COVID-19. It's called the S protein or the spike protein. The virus needs that protein to latch onto our cells and take over the processes that allow it to replicate inside us and cause infection and disease. So, what the creators of this vaccine did was they took just that protein code and they put it in the vaccine. And that genetic material helps our bodies to create the protein, but it does not contain any virus. So our bodies make the protein. And then we start to develop antibodies to the protein so that the next time our bodies see the virus, they'll identify the protein and destroy it. And it's a self-limiting process. So our body doesn't keep making these proteins forever. As it builds up the antibodies kill the protein. And then the mRNA that delivered the message is gone.
So it's almost like you get an Instagram message with the face of a bad guy that the cops are looking for, and now you can watch out for him. Is that a fair analogy?
Yes, it's sort of, I'd say that's a decent analogy because what you're looking at is just one aspect of the criminal. You're not having the police bring the criminal to your house and like
Mhm.
shake his hand and be like, is this the guy? It's just, a one image or one aspect of the criminal that you have to identify, and that's enough for the cops.
Nice. Okay.
I don't know.
And then it's gone, right? So now
Yep,
we
it
know
doesn't stick
we've
around.
got it. Yeah. Well, so I keep hearing this number, 95% efficacy or effectiveness for both the Moderna and the Pfizer vaccines that are
Mm.
coming out.
Yeah,
What does that
yeah,
mean?
it's incredible because, like I mentioned before, the vaccine's a little different than other vaccines that we've had, our more common vaccines, and it's also been developed and tested and approved more rapidly, I think, than any vaccine in our history. Um, and despite having been so quickly studied, it was still studied on tens of thousands of people with all different underlying medical conditions, different demographic markers, different age groups, including the very old. Um, Despite the fact that it was tested and studied and approved so quickly, it's still incredibly effective. And the way they test the effectiveness is uh, they let's just take one of the studies for example. So the Pfizer study enrolled 40,000 people. It has two arms. The half of the group that are going to get the placebo injection, and then the other half, which get the actual vaccine injection. And they give the injections to these people and then watch them over time. And they count the number of those people who, while in the study, develop COVID-19, who did not have it before, because people with COVID-19 were excluded from the study. Now, when they count the number of people who develop the disease while in the study, they're able to compare those numbers between the two groups, placebo and vaccine. And they discovered that the people in the vaccine group had 95% less risk of getting COVID. They were protected that much more. It's a really astonishing difference, which is why the vaccine was approved so rapidly.
Well, are there people who shouldn't get vaccinated?
That's a great question. So, eventually, I'm hoping the vaccine will be safe for most, if not all, people. But in the initial study, there were several groups that were excluded. The vaccine won't be offered to these groups yet. That includes children younger than 12, it includes pregnant women, and it includes people who have compromised immune systems or are on immunosuppressive treatment for some medical condition.
Well, what about you mentioned pregnant women. What
Mhm.
about someone who is looking to get pregnant? Should they still get vaccinated before they're pregnant?
This is such an important question. The answer is yes. If you are a woman and you are planning to become pregnant, or there's a chance you could become pregnant, you should definitely get vaccinated. Although pregnant women were excluded from the study this time around, there were women who were in the study and then became pregnant while in the study. So they're included in the safety profile, which is excellent. So I would recommend the vaccine to women who aren't but could become pregnant.
Well, I've been hearing about some side effects. There's
Mhm.
been just a handful of cases of people who've had severe reactions to the vaccine.
Sure.
And then, of course, there's reports of people who just, don't feel very well after they get the vaccine. What are the side effects that we can expect, and what would be a concerning side effect?
Absolutely. This is great. Because I want to talk about the side effects. I also want people to be prepared for the possibility that they could experience any kind of side effect, be it mild, moderate, or severe, um, after either the first or the second shot, even if they've never had a reaction to a vaccine before. So, the most common side effects are two different kinds. First, just local injection site symptoms: pain, redness, swelling. Most people who reported having those symptoms had them very briefly and they were mild. Uh, the second type of common reaction is going to be sort of mild flu like symptoms. The most common are going to be fever, chills, headache. Some people had muscle aches. Some people experienced swollen lymph nodes. Some of those symptoms could last several days and remain mild. Most of the time, they resolved, both these local injection sites and mild flu like symptoms, after 2 to 3 days. Um, the symptoms that would be really concerning and should prompt people to seek care emergently would be severe symptoms that are systemic, meaning throughout your body. And that includes severe allergic reactions like anaphylaxis. Symptoms that would be most concerning would include trouble breathing, uh, a swollen throat or tongue, or swollen lips. You might experience mildly some scratchy throat or puffiness around the eyes, and mild headache. But if you had severe headache or other severe throat related symptoms, you should definitely seek emergent care.
So, for people who do get these flu like symptoms, does that mean they're getting sick?
That's a great question. The flu like symptoms that people experience after getting this vaccine feel like they're getting sick, but they are not getting sick. So they're not getting the coronavirus. What's happening is the body is creating inflammation, and that's how we build immunity. It sends all of our inflammatory cells throughout our body to help to recognize the problem and create antibodies. And that process sometimes makes us feel very sick, but it isn't an actual viral infection.
Okay. So, it's a sign really that your body is reacting and building up this
Yeah.
immunity.
That's right. It is a sign. When I have those symptoms after I get a flu shot, I feel a little safer because I know that my body's doing its job and creating the antibodies I need to help protect me through the flu season. Sometimes I don't have those symptoms, but I still want people to know their body is working on creating this immunity anyway, even if you don't have severe symptoms.
Great. Well, it's good to know what to expect. Hey there, Felicia here. Thanks for listening. There's no way I could cover all of your questions in one conversation. So, if you have a question about COVID-19 or any other health issue, please call 503-338-4654 to leave me a message. I'll do my best to get you an expert answer in an upcoming episode. Well, you as an emergency medicine physician, you are one of the first people in line in our county to get vaccinated. How do you feel about that?
I'm so excited about it. Obviously, ideally, I would want everyone to get vaccinated as soon as possible because I know that's the best way that we can protect our community from severe COVID-19. But when I think about how we have to protect the frontline caregivers first so that we can keep the hospital open to take care of everyone else, I am just so excited and I feel so lucky to be among that group. And as I get my vaccination and I wait to build up immunity, and then I wait to get my second shot and my immunity gets even better, that whole time I'm going to start feeling a little safer. I'm going to be less anxious that I'll get sick and not be able to staff the emergency department. I'm going to be less anxious that I could get a cough and spread droplets and aerosols and put others at risk. I will be waiting and hoping that the scientists who continue to study the vaccines find that the vaccine does more than just protect me from the coronavirus. I will hope that they find that the vaccine actually prevents infection and that my being vaccinated protects everyone else, including the people who can't get vaccinated themselves. Protecting children, protecting pregnant women, people with compromised immune systems, and protecting my family, including my baby who won't be able to get vaccinated. I'm very excited to be vaccinated. I wish that my family could be vaccinated too. I know I'm eager for the vaccine to be more widely available.
So I've been hearing that even if we get the first shot, we're not protected yet, that we have to get that second shot, that we've got to wait, that we've got to wear the masks. What's going on there? Why can't we just get the one?
Yeah, this is so important to understand. Um, when we get a vaccination, we are not immediately immune. The vaccine takes weeks to allow our bodies to build up the appropriate level of antibodies so that we can fight off the infection. The 95 or 94% number that you've been hearing when people talk about the effectiveness of these vaccines takes 6 weeks to accomplish, 6 weeks and 2 doses. So the way they achieve that effectiveness is they give you the first shot of vaccine. About 2 weeks after that first shot, you are reaching 54% effectiveness in preventing symptoms of severe COVID. Then you get either 3 weeks later if it's Pfizer or 4 weeks later if it's Moderna, you get the second shot. About 2 weeks after the second shot, that's when you hit 95% effectiveness and not before. So that whole 6-week period, the person who's vaccinated is still at risk, not just of getting the infection, but of developing severe symptoms of COVID-19.
You mentioned that 2 weeks after the second dose, we are much less likely to develop symptoms of
That's
severe
right.
COVID-19. But
Mhm.
one thing that I heard in there was that that doesn't necessarily prevent us from transmitting the disease. So we can still carry it, right?
We don't yet know if this vaccine helps prevent us from becoming infected with coronavirus in a way that then could lead to us transmitting the virus to others, even though we ourselves, as the people who are vaccinated, are not developing symptoms of COVID. So, in other words, we could still have asymptomatic transmission of the virus. The benefit of the virus, while we are waiting to see if the vaccine prevents transmission of infection, which it may eventually do, while we're waiting to discover that, we do know that we, as the vaccinated people, will have less severe symptoms and will be less likely to have severe COVID. And just being asymptomatic reduces our risk of having, for example, a cough that creates droplets and aerosols that can then reach out and infect other people.
But in terms of, let's say, your job, for example, you're going to be vaccinated in the next few days, and then you'll have
Mhm.
your next dose in another month.
Right.
You still will, during this pandemic, to protect your family. you need to still be masking and doing all of those social distancing things in order to not be bringing it home.
That's absolutely right. I cannot become lax, and no healthcare workers or others can stop wearing masks, stop having excellent hygiene and cleaning practices, because there's still a chance that the virus is present and can be transmitted.
If we were going to leave somebody who's on the fence about getting the vaccine with one thing to think about, one message to take home, what would it be?
This is a really important question. So, the take home message here has to be that the vaccine is our best hope of ending this whole pandemic and finding our way back to our normal lives. We, in order to protect ourselves and each other, should really strongly consider doing absolutely the most we can do to bring this pandemic to an end. Vaccination's our best hope. So I would hope that everyone who can be vaccinated will be vaccinated, because that's how we will help our community and not just ourselves and our families. And this community is so important to all of us. I know that that's what we want.
Absolutely. Absolutely. It'll be so good to see people's faces and be back at the Sunday market and doing those sorts of things again, hopefully 2022 at the latest.
Yeah, I hope for the same as soon as we can. And
Well,
I'm going to
and
do everything I can to bring that about for hospital staff, for our community. Everything we can do, we're going to do. I'll be first in line to get the vaccine, and I'll be very happy to be the guinea pig for everyone. If they're waiting to see what happens, they can just watch.
all right, well, we'll try and catch you on tape and share that because I think it is important for people to see. It's like you said, it's our best course of action
Yeah,
to get back to our normal lives. I loved how you said to finding our way back to our normal life because
right
it
on.
it, it is. It's going to be a road back. It's going to be
It's not going to
that
happen
is
right away. It's not going to
no.
happen right away. And it's so hard for me to ask people to keep being patient. Everyone has been so patient. Everyone has been working so hard to do their best to be safe, to protect themselves, to follow the guidelines being provided, to follow the restrictions. It's hard to ask people to keep doing that. But I think, guys, the end is in sight. The end is in sight. The light at the end of the tunnel is here. And I think it's the vaccine. And we just have to wait 2 weeks after that second shot, and our immunity will be built up. And every person who reaches that point makes our community that much safer, one at a time.
Mhm. Well, I'm in line behind you. When I'm able to get my shot, I will.
Super.
Well, thank you so much for joining us, Dr. Mysliwiec. It's great to see your face, and we're not hiding behind a mask. And
Thanks so much for doing this with me.
yes, thank
I appreciate
you.
it.
Thank you for joining us today. I'm Felicia Struve, and this has been an episode of Hands on Health, brought to you by Columbia Memorial Hospital.